Guys, this is Mubin. We are talking about cardiovascular system general principles. Let's continue and now discuss what will happen when various changes occur in the lung, in the factors that are controlling the lungs. Before we go there, I want to do one more thing, one more difference from systemic circulation, and that is the pulmonary capillaries diameter and the control of that. So let me make a little diagram here. What happens is, let's say this is the pulmonary artery bringing the deoxygenated blood in. Then we have, let's make a green colored capillary here. This is a pulmonary capillary, and then let's make an artery here. So the blood comes in, flows through the capillary, and then goes out. On the capillary is present the alveolus, right? This is the alveolus. Now this is the second difference from the systemic circulation, and this is where they ask you many questions here. What happens is that based on the oxygen content of the alveoli, or based on the oxygen content of this area, the capillary diameter will be controlled. So normal systemic behavior is that hypoxia will dilate the blood vessels to increase the flow of the blood to a particular area which is experiencing hypoxia, which is experiencing less oxygen. In the lungs it is the reverse. If the oxygen level is low in some part of the lung, then the capillary in that area becomes constricted and shuts down. Do you think it's a good thing? Have you read the dead spaces yet? What do you think? Is it good or bad? Look, it is good. Why it is good is, if this alveolus is not functioning, somehow the blood, it doesn't have oxygen. Maybe the alveoli, the bronchiole here is collapsed. Maybe there is a mucus plug stuck here. Maybe there is some infection here. Maybe there is some foreign particle that came in and got stuck somewhere up here. The end result is that the alveolus does not have oxygen. If the alveolus does not have oxygen, if there is no oxygen, do you think that bringing blood to this alveolus is useful? No. This blood is going to do nothing. It's not going to do gaseous exchange. This door is closed. So it is smart of the pulmonary vasculature to say, all right, there is going to be no gaseous exchange here. I'm going to shut down this channel. I'm not going to bring blood here. That is why the hypoxia causes the pulmonary capillaries to constrict, while hypoxia in the systemic capillaries causes them to dilate. That is and of course the vice versa. So that is another big difference in the pulmonary circulation compared to this systemic circulation. All right, let's continue discussing what would happen. So let's look at some factors. Let's see what happens when we are exercising. Exercise. I'll go through this table. This table has 12 columns. What are the columns here? Pleural pressure. What happens to the pleural pressure? What happens to the vessel compression? Pulmonary vessel compression. What happens to the venous return? Right heart return, which will be the inferior and superior vena cava bringing blood to the right heart, or to the left heart, that is the pulmonary vein bringing blood back to the left heart. What happens to the cardiac output, blood volume? What happens to the resistance of the pulmonary vasculature? What happens to the flow of blood through the pulmonary vasculature? What is the pulmonary vascular pressure? What is the systemic blood pressure? And what happens to the heart rate? So let's look at it. Exercise. I'm going to draw the diagram over here. For this, what we'll do is we'll have a conceptual diagram. The conceptual diagram is this. Let's say this is thorax or thoracic cavity. This is body. In this thoracic cavity, we've gotten the right heart. This is the right heart, right atrium and right ventricle. This brings blood to lungs. Lungs give blood back to the left heart. So right atrium, right ventricle, lungs, left atrium, left ventricle. From the left ventricle, the blood, so the red one are oxygenated bloods, blood goes out to the body, this is body. From here, the venous blood, after the capillaries have been encountered, venous blood would go back to the, I'll make it this way. Okay, cool. So the venous blood goes back to the right. So this is the channel, this is the series circuit. During the exercise, what happens? Couple of things. Number one, cardiac force of contraction increases. Cardiac rate would increase as well, heart rate. So that would increase the cardiac output. So one thing, we'll say here the cardiac output will increase a lot. Why? Multiple factors. One of the factors is force of contraction of the heart is increased. Second factor is heart rate is increased. Third factor is venous return has increased. Why? Because the muscles are contracting. Muscles, when they contract, they act like pumps and they circulate the blood back towards the heart. So the venous return has increased. Now, what will happen? Let's look at it. When the output has increased, cardiac output, that would increase the venous return on the right side. Venous return, don't say blindly that the venous return on both sides have increased. On the right side, the venous return has increased. That will mean that the blood flow to the lungs, increased blood volume to the lungs, right? So I'll say blood volume to the lungs have also increased. That also means right heart venous return has also increased. However, because the pulmonary circuit is a compliant circuit, it's a passive circuit, as the blood comes into the pulmonary vessels and it is more blood, what would happen is that the pulmonary vessels would dilate. That means what would happen to the resistance? It would reduce. If it was systemic tissue and systemic vessels, then the vessels would try to maintain the lumen and they would try to constrict. Here they are increasing, so resistance will go down. Resistance would go down. What would that do? If the resistance reduces, that would cause the flow to be increased. Some pressure would increase, not too much, but some pressure would increase. So the end result is, if the resistance has increased, if the vessel has become dilated, plus there will be recruitment, what will happen to the pressure within the pulmonary system? Too much increase,